Hi everybody, Dr. Debunk here, doing another video to debunk medical myths, garbage, and crap spread by doctors and other health professionals. This is like kind of part two. I just did a video on the medication treatment of colds and flus. Colds and flus are annoying, and your body fixes itself, and you don't really need to do anything. You don't need to see doctors, and that's what I talked about. And so I went through the four basic groups of medications that are very good that you can take to give you a lot of relief. Because if you can get enough relief with the flu, then you really don't need to see your doctor. He's not going to do anything anyway, unless you beg him for antibiotics, which you shouldn't be taking anyway for a virus infection. But to get rid of you, the doctor will give you a useless antibiotic that will screw up your normal germ flora and cause you problems when you're older. So we don't like that movie. But this is about the natural treatment, specifically one product called KSK Cold Spray. Now, there's all kinds of naturopathic techniques for colds and flus. I haven't had the time to study them. I'm sure some work. I'm sure there's science on some of them. But I'm not an official naturopath. I've just developed my own natural techniques. And so a long time ago in 2016, I had a bunch of happy coincidences that got me started on trying to get a natural way to treat colds and flus, a natural way to give people something to do that would speed up the recovery of a cold and flu so that you wouldn't have to see your doctor and you wouldn't beg me for antibiotics. And I was playing on something that had been tried many times for 40, 50 years. And that is there a way to kind of nip a cold or flu in the bud? In other words, if you could, once you're exposed, if you could sterilize your upper airways, then you wouldn't get sick. So what do I mean by that? So how do you get a cold or flu? Well, this is what happens. You're in a store, you're in a house long enough that somebody's sick and they're coughing and they're spreading cold or flu viruses, and we'll talk about flu. They're spreading enough influenza this year that you get a high enough load of the virus that it can get a foothold in your tissues and your upper airways, and you get sick. And so by breathing in billions and billions of viruses, they can finally, get into the tissues. So here's my hand representing the thickness of your upper airway, say your upper airway tubes. On the top of it is a mucus lining. When you're breathing in and out, the germs, if there's enough, are saturating the mucus lining. And then when they get deep enough in the lining, they'll start to get into the tissues like this. And once they get a foothold in the tissues, you're going to perceive you're getting sick. And there's some videos out there you can see that are on YouTube how this works. But basically, it's the viral load over what period of time that you're exposed to that finally gets enough virus into the tissues of your upper airways, and it starts the infectious process. And if your local immunity in the tissues can't handle the amount of viruses, you're going to get sick. Now, this is a process that takes about 2 to 5 hours. And so in a typical scenario, you wake up Monday morning, you're fine. You go to work in the morning and a bunch of people are sick. They're filling your office space with viruses. And in the afternoon, at 1 o'clock, you start to notice a tickle in your throat. Like most people will have one of two things when you start to get sick. Your throat gets a little sore, irritated, or your sinuses. And then it progresses into a cold or flu. So if it's, and it's usually always the same. So if it's, and the most common is the throat. People get a little tickle in their throat and you're like, oh, what is that? And it goes away. Whatever. Hour later, it comes back. Half hour later, stays a little longer, still goes away. You're working, you're ignoring it. But finally, this pattern occurs enough, and you have this reality moment where there's enough germs getting in your tissues that it's actually triggering your nervous system, and you become aware, wait a second, I'm getting sick. You just kind of feel it. And it's usually 2 to 5 hours. And then it's downhill from there. So if you have the flu, it just gets worse and worse. And if it's a 7-day flu, every day progresses. Day 3 or 4 is the worst. Okay, but what about back at the beginning? Is there a way to stop it? Well, in medical science, we haven't had a way, because what has been tried for 50 years is, well, if you could sterilize your upper airways after exposure, then maybe you wouldn't have enough germ loads and you could stop the infection before it gets going. And that was always theorized, and multiple things were tried, natural germicides and even drug-based germicides. But there was a lot of problems with it, and it never went anywhere. And then COVID hit. And COVID has now proven that this works. And so what happened was in 2016, for a lot of happy coincidences, I got interested. And so I started experimenting because I knew from other natural things I'd done that 8 of the human minerals, of the 17 or so we need, are natural germicides. Selenium, iodine, magnesium, copper, zinc, all of these. In fact, the most successful product that I am aware of was Zicam nasal spray way back 20 years ago or something. And all that was in there was zinc. And if you sprayed a lot, you could interrupt the cycle and maybe stop the cold or flu. That's what their claim was, and it actually kind of worked. But then they got in trouble for things they were doing. I won't get into it. It was just too much zinc. If you overspray zinc into your nose, you're going to mess up your sense of smell temporarily. And the FDA said some people it was permanent, so they took them to court, blah, 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 this whole thing. But other people have tried over the years, and you can find some of these studies, the natural sprays, minerals, and then there's nutrients, there's herbal extracts, that if you could spray enough, the idea is you could get better. Well, never it really worked or took off, or if it did, it didn't go anywhere. Now, you can see a lot of these cold and flu products that have been out there over the years, magical. People talk about colloidal silver, which probably works, but it's a poison, so I don't like it. I know a lot of you natural people like colloidal silver, but it's a poison, not just to the germs. Whereas if you could do enough copper is a great germicide. Copper kills everything. If Martian germs come here, it'll kill them. But you can't spray copper in the nose, just like you can't spray zinc in the nose. So I, with others, came up with the idea of mixing certain minerals and using something called nanoparticle mineral technology. And so we started a process, and eventually I had 5 partners, and we were able to develop a product. But then when we started to really test it, we ran into problems, and the bottom line is it all kind of went sideways. And then I had to start over. And so I ended up with 1 partner. So now it's just me and John. But by 2018, we had broken through the barriers of problems and came up with a product, and that product is this KSK Cold Spray. So yes, it is a financial interest of mine, but I'm going to try to convince you by what we've done that it's actually legitimate, and whether you want to buy this or not, but at some point you should try it. So by the start of 2018 and then 2019, we had 2 years to beta test the product, which we did. And we went to 2 big health conventions and had probably 3,000 people and patients use the product. I did a small scientific study where I used patients and tabulated results. And there's no question that this product is germicidal. I did some microbiological testing. And there is no question that this product kills basically all germs on contact. The same way peroxide can do it. The same way alcohol can do it. And the tests show it. And then throughout medical studies, you can find all kinds of evidence of zinc's germicidal abilities, copper's germicidal abilities, magnesium's germicidal ability. And so with a lot of trial and error, we came up with a product. And now, and then COVID hit and messed it all up, and we had to kind of go on hold because the government went after anybody who would say that they had a product that might help for COVID. That was not allowed. It was only the magic, nasty vaccine. So anyway, the evidence is overwhelming. I've been doing it now in my practice for a long time. And here's how the product works. It's a mixture of minerals and nanoparticle minerals that are all germicidal. And so the concept is you spray it in your nose, mouth, and throat at the first sign of a cold or flu. And if you do that, it is 90% successful at stopping it right there. And there's a whole thing of how you do it. There's a little spray cycle of how you do it. We learned the hard way, like everybody else, how to overcome the barriers, why no one else has done this before, because there is no product out there that's like this. Not that I'm aware of. I know someone has come up with using nitric acid in the same way as a topical spray to try to reduce the exposure of COVID, which it could work. I could see how nitric acid could work. I hear there's another product. I haven't had a chance to look at it. But just the idea is that if you jump on the exposure, if you jump on the amount of germ load that you've been exposed to, and you kill off, a bulk of the germs, there's not enough left to infect you. I mean, we're breathing in billions of germs every day, trillions. It's so much. And so the biggest proof came from my patients and I when COVID hit. The people, my patients that have been using it for a long time, I have people that travel, they're salesmen who don't get sick anymore with colds or flus because of the spray. We all went gaga with the spray. And I treated 300 patients in my office with COVID, and I never got it. And I never wore a mask after the first year. And people are hacking COVID in my face. Well, how could I not get it? I'd never had COVID before. It didn't exist before. Because I'd walk out of a room and I'd sterilize my upper airways. And I didn't know if it was going to work, but I knew COVID wasn't going to kill me. So I took the chance, never got it. I finally got Omicron in February of 22, but Omicron was a cold variant of COVID-19, so who cares? Anyway, I can tell you conclusively the product works. You'll just have to try it to see. Though how you get the product is, it's right here. It's called KSK Cold Spray. I feel kind of crappy advertising, but this is the only product I have. I'm not really doing these videos for money per se. But you can see right down there above the little virus. That's a virus, by the way. That's one of the way little bastards look. And it says kskcold.com. That's all you got to do is go there, kskcold.com. And the website isn't that big. There's article, there's things that I've written. There's a video to show you how to use it. If you're interested, go look. Just look and read the information. I go into much greater detail, and you can decide for yourself if the evidence warrants a trial. It's cheaper than anything else out there. But the point of this was how to naturally treat a cold or flu. Well, you can use this for treatment. It will shorten the time of your cold, but the best way to use KSK Cold Spray, without a doubt, and we have literally 7 years now worth of patients and data, is when you have that reality moment, as I mentioned, when you realize, oh, I'm getting sick. If you spray the spray in your nose, mouth, and throat, and then spray it again 5 minutes later, spray it again 5 minutes later, 3 applications, it cures 90% of people right there. Your tickle in your throat goes away, your sinuses go away, and you're fine. You might have to do it again the next morning. You might get the little tickle back, but you do it again like that, you're done. Now, the spray cycles are very long. If you're sick, you have to spray a lot, and the website will tell you how to do that. The box, what I did was, for simplicity, the box has all the instructions all the way around, and then the bottle has more instructions, and there's no flyer, so to make it simple. But you will be impressed by the product. It absolutely works, and it's all natural, 100%. You could drink it, doesn't matter. You could drink multiple bottles. It wouldn't help you, but I don't recommend drinking it. But it's a mixture of minerals, and that's it. And there's some herbal extracts that I use, and you can look at the bottle and look them up yourselves. But partly I'm doing this now. Yes, it's a business thing, but for those of you that are aware, and this may sound a little political, I'm not sure if that's the right word, but COVID-19 was accurately predicted by the Bill and Melinda Gates Foundation World Pandemic Forum Summits. Now, I don't care for him and I don't care for his summits, but whether it's legit or not, who can say? But in October of 19, they predicted the COVID outbreak, and it happened 5 months later. Well, in October of 22, they met again and had another forum. They called it Catastrophic Contagion Summit. And they are predicting another pandemic worse than the first one, and it's going to happen in October of 25, the fall of 25. Now, we'll see. Nobody listened to the first summit, but everybody's listening to the second. So we'll see what happens. But my patients and I, without a doubt, proved that the spray works against COVID. I mean, the COVID virus is SARS-2. It's a coronavirus. It's like all other viruses that are killed by all the standard topical decontamination techniques, or disinfecting techniques. That's the word I was looking for. You know, I mean, all the common sprays in your home to kill germs on contact that you can buy, a million of them off the shelf. You know, very quickly they all said, oh, this will kill COVID too, because it's nothing magical. It's just a more infectious and more contagious germ than any other coronavirus in the history of coronaviruses. But anyway, and so KSK works. And in the next pandemic, upper airway sterilization is going to be huge. And I don't care. This nitric acid product, there's another product, like I said, I don't care, what you do. But the need for you after an exposure environment, after you have been in a home or someplace and you realize, wow, I could get this germ. Because the next pandemic, according to the World Pandemic Forum, is going to be much worse. And so sterilizing your upper airway would be critical. And so that's another reason I'm doing this video specifically, because it's not just a treatment for colds and flus. And we'll see what happens in 2025 or sooner.